Most men unknowingly make mistakes that worsen prostate health. Avoiding these three can make a big difference. First, not drinking enough water. Dehydration irritates the prostate, leading to inflammation and urinary issues. Second, eating too many processed foods. They cause weight gain, hormone imbalances, and prostate enlargement. Third, sitting too much. Poor circulation increases inflammation and worsens symptoms. Stay hydrated, eat clean, and stay active. Small changes can protect your prostate. First, we have ignoring symptoms. Ignoring symptoms of a prostate condition might seem harmless at first, but it can lead to serious consequences over time. Many men dismiss early warning signs like frequent urination, difficulty starting or stopping urine flow, or even mild discomfort, thinking it's just a minor issue that will resolve on its own. However, the longer these symptoms are ignored, the more severe the condition can become. What starts as a manageable problem can gradually worsen, leading to complications that may require more aggressive treatment. The body often signals distress through symptoms, and when these warnings go unaddressed, the underlying issue continues to progress silently. One of the most dangerous aspects of ignoring prostate symptoms is the gradual enlargement of the gland. Benign prostatic hyperplasia, BPH, is a common condition that causes the prostate to grow, pressing against the urethra and making urination difficult. If left unchecked, the bladder has to work harder to push urine through, leading to thickening of the bladder walls and decreased efficiency. Over time, this strain can cause urinary retention, where the bladder is unable to empty completely, increasing the risk of infections, bladder stones, and even kidney damage. What may have been manageable with lifestyle changes or mild medication in the early stages could require surgical intervention if ignored. Prostatitis, another common prostate condition, can also worsen significantly when symptoms are disregarded. This inflammation of the prostate can be bacterial or non-bacterial, often causing pelvic pain, painful urination, and discomfort in the lower abdomen. When left untreated, the infection can spread, leading to complications like chronic pelvic pain syndrome or even systemic infections. What could have been managed with antibiotics or simple treatments may escalate to a persistent long-term issue that affects overall well-being and quality of life. Ignoring these symptoms allows the inflammation to persist, causing ongoing discomfort and making treatment more difficult. Ignoring early warning signs can also increase the risk of developing prostate cancer. While not all prostate symptoms indicate cancer, persistent urinary problems, blood in urine or semen, and unexplained weight loss can be red flags. When these symptoms are ignored, the cancer has more time to grow and spread beyond the prostate. Early detection is key in successfully treating prostate cancer, as it is far more manageable in its initial stages. However, when symptoms are overlooked, the disease may advance to a stage where treatment options are limited, more aggressive, and less effective. Another hidden danger of neglecting prostate symptoms is the psychological and emotional toll it takes. Living with persistent discomfort, interrupted sleep due to frequent nighttime urination, and the constant stress of an unresolved health issue can lead to anxiety and depression. Many men feel embarrassed or reluctant to discuss prostate problems, leading them to suffer in silence. This reluctance prevents them from seeking medical advice, which only worsens the condition over time. What might have been an easily treatable issue turns into a significant burden on both physical and mental health. Ignoring prostate symptoms also affects overall sexual health. Prostate conditions can lead to erectile dysfunction, painful ejaculation, and reduced libido. When symptoms are left unaddressed, they can contribute to a decline in intimate relationships and self-esteem. Many men underestimate the impact of prostate health on their sexual well-being, only realizing the consequences when it's too late. Seeking medical attention at the first sign of trouble can help prevent these complications and maintain a healthy sex life. Next, we have poor diet choices. The choices made in daily meals can have a significant impact on prostate health, and poor dietary habits can accelerate the progression of prostate conditions. Many men underestimate how much their food choices contribute to inflammation, hormonal imbalances, and overall prostate function. Consuming the wrong foods regularly can worsen symptoms like frequent urination, discomfort, and swelling, making conditions like benign prostatic hyperplasia, BPH, prostatitis, and even prostate cancer more severe. While medications and treatments can help manage prostate issues, a bad diet continues to fuel the problem, making recovery harder and complications more likely over time. One of the biggest dangers of a poor diet is chronic inflammation. Processed foods, fried meals, and sugary snacks increase inflammation in the body, which directly affects the prostate. Inflammatory foods trigger an immune response that causes swelling and discomfort in the prostate gland, making it harder to urinate and increasing the risk of infections. When inflammation persists due to a constant intake of unhealthy foods, the prostate remains irritated, worsening existing conditions and making treatments less effective. Reducing inflammation through proper diet choices is key to managing prostate health. Excessive consumption of red and processed meats is another major factor that contributes to prostate problems. Studies have shown that diets high in these meats increase the risk of prostate enlargement and even cancer. The reason behind this is the high level of saturated fats and harmful compounds like heterocyclic amines, which form when meat is cooked at high temperatures. These compounds can promote oxidative stress, leading to cell damage in the prostate. Over time, this damage accumulates, making it more difficult for the body to repair itself and leading to worsening prostate conditions. Dairy products, especially those high in fat, are another hidden contributor to prostate issues. Many men consume large amounts of milk, cheese, and butter without realizing that these foods can disrupt hormone levels. Dairy contains high amounts of estrogen-like compounds, which can interfere with the body's natural testosterone balance. Since testosterone plays a crucial role in prostate health, disrupting its levels can lead to an increased risk of enlargement and cancer. Additionally, dairy can contribute to inflammation, further aggravating prostate discomfort and urinary issues. Sugar and refined carbohydrates are among the worst offenders when it comes to prostate health. Foods like white bread, pastries, sodas, and candies cause blood sugar levels to spike, leading to insulin resistance and increased fat storage. Excess fat, particularly around the abdomen, is linked to higher estrogen levels and chronic inflammation, both of which negatively affect the prostate. The repeated consumption of high-sugar foods also weakens the immune system, making it harder for the body to fight infections and heal from prostate-related conditions. A diet high in unhealthy fats, such as trans fats and excessive omega-6 fatty acids, can also worsen prostate problems. These fats, found in fried foods, margarine, and many packaged snacks, contribute to inflammation and oxidative stress. Unlike healthy fats like omega-3s, which reduce inflammation and support cell function, unhealthy fats increase the risk of cell damage and prostate enlargement. The more these harmful fats are consumed, the greater the likelihood of developing more severe prostate issues over time. Alcohol and caffeine are two common dietary elements that many men overlook when assessing their prostate health. While occasional consumption may not cause immediate harm, regular intake of alcohol and caffeinated beverages can lead to dehydration, increased bladder irritation, and worsened urinary symptoms. Alcohol, in particular, contributes to hormonal imbalances and inflammation, making prostate conditions harder to manage. Caffeine, found in coffee, energy drinks, and sodas, acts as a diuretic, increasing the urge to urinate and further straining the bladder and prostate. Last, we have sedentary lifestyle. A sedentary lifestyle is one of the most overlooked factors that contribute to worsening prostate conditions. Many men spend hours sitting at desks, in cars, or on couches without realizing the harm it does to their prostate health. Lack of physical activity slows blood circulation, weakens muscles, and leads to weight gain, all of which create an environment where prostate problems can thrive. When the body remains inactive for long periods, the prostate receives less oxygen and nutrients, making it more vulnerable to inflammation, enlargement, and other complications. Poor circulation caused by prolonged sitting is one of the biggest risks to prostate health. When movement is limited, blood flow to the lower abdomen, including the prostate, decreases significantly. This reduced circulation means that the prostate is not getting the necessary nutrients to function properly, leading to irritation and swelling over time. In some cases, stagnant blood flow can also increase the risk of developing prostate infections, as harmful bacteria are not efficiently flushed out of the system. Weight gain is another serious consequence of a sedentary lifestyle that worsens prostate conditions. When physical activity is low, the body stores excess fat, especially around the abdomen. This extra fat produces inflammatory chemicals that negatively affect the prostate, leading to chronic inflammation and increased discomfort. Obesity is also linked to hormonal imbalances, particularly higher estrogen levels and lower testosterone levels, both of which contribute to prostate enlargement and a higher risk of prostate cancer. Sitting for long hours puts direct pressure on the prostate, which can lead to increased discomfort and irritation. The constant compression of the prostate gland reduces its ability to function properly, making urinary symptoms more severe. Men who spend most of their day sitting often experience difficulty urinating, increased urgency, and a weaker urine stream. Over time, this repeated pressure can contribute to chronic prostatitis or worsen benign prostatic hyperplasia, BPH. Hormonal imbalance caused by a lack of movement is another way a sedentary lifestyle negatively impacts the prostate. Physical activity plays a crucial role in regulating testosterone and other hormones that support prostate health. When exercise is minimal, the body struggles to maintain proper hormone levels, leading to an increased risk of prostate enlargement and other related issues. Regular movement helps balance these hormones, reducing the likelihood of prostate complications. A weakened immune system is another hidden danger of prolonged inactivity. Exercise is known to boost immune function, helping the body fight off infections and reduce inflammation. When movement is lacking, the immune system becomes less effective, making the prostate more susceptible to infections and diseases. Prostate infections can be painful and difficult to treat, especially when combined with other risk factors like poor diet and dehydration.